Hello everybody, it's Caafimaad here. This video is about a stroke versus TIA. We are going to talk about causes, signs and symptoms, risk factors, the golden time of a stroke, and a little about heat stroke. The terms stroke and TIA are often confused with each other. If you want to understand the differences between a stroke and a TIA, you need to learn the characteristics of both. A stroke is an interruption of blood flow to an area of the brain that lasts for a long time to cause permanent damage to the brain. On the other hand, TIA stands for a Transient Ischemic attack. A TIA is a temporary interruption in the blood flow to an area of the brain, and it does not last long enough to cause permanent damage to brain. Causes. A stroke can be caused by ischemic, that means lack of blood flow, or hemorrhage, that means bleeding. A TIA is always caused by a temporary ischemia, not bleeding. Bleeding on the brain does not resolve before damage occurs and cannot be transient. The causes of an ischemic stroke and a TIA are the same. They include heart disease, blood clotting problems, blood vessel abnormalities, such as the ones caused by hypertension, diabetes, high cholesterol, and smoking. A bleeding blood vessel can cause a hemorrhagic stroke, but because the damage of a hemorrhagic stroke is permanent, a bleeding blood vessel does not cause a TIA. However, a damaged blood vessel may cause a TIA before it bleeds. Here we're gonna study signs and symptoms. The symptoms of stroke and TIA are divided to the short terms and long terms. So first we are going to check out short terms. The short-term effects of a stroke or a TIA are the same and can include any combination of the following. Nausea, heat, speech problems, headache, loss of coordination, weakness, face drooping, vision changes, tachycardia, and finally, confusion. These short-term symptoms are based on which region of the brain suffers from a lack of blood supply during a stroke or a TIA. After a stroke, a survivor has permanent deficits that correspond to the damaged area of the brain. Now it's time for check out long terms. In the long term, a stroke can cause permanent disability that correspond to the short-term effects. Usually, the long-term effects of a stroke show some improvement over time. However, a stroke can also get larger or can cause swelling in the brain. So the long-term effects may be even more extensive than the short-term effects of the stroke. A TIA completely resolves that does not cause any long-term effects or handicaps. Here we are talking about the golden hour. A door to treatment time of 60 minutes or less is the goal. This 60-minute period is often referred to as the golden hour of acute ischemic stroke treatment. It has 4 stages. In the first 10 minutes, some brain regions already are irreversibly lost. In the first 1 hour, more time elapses, more brain tissue dies. Urgent treatments could still limit the disability. After 3 hours, the window is closing. Treatments at this time may result in moderate disability. And finally, after 6 hours, without treatments, all at-risk tissue has died. The unfortunate result may be severe disability. The risk factors of stroke and TIA include high blood pressure, obesity, lack of exercise, sleep apnea, heavy drinking, high cholesterol, cardiovascular disease, diabetes, drug use, and smoking. One of the most important strokes is heat stroke. The heat stroke is a condition caused by your body overheating, usually as a result of prolonged exposure to or physical exertion in high temperatures. This most serious form of heat injury can occur if your body temperature rises to 104 Fahrenheit or higher. The condition is most common in summer. Heat stroke requires emergency treatment. Untreated heat stroke can quickly damage your brain, heart, kidneys, and muscles. The damage worsens the longer treatment is delayed, increasing your risk of serious complications or death. So, what is the signs and symptoms of heat stroke? Red skin, heartbeat, vomiting, weakness, tremor, headache. Finally, we have tips for preventing heat stroke for you. Wear protection. No alcohol. More water. Limit outdoor. No silk and dark clothes. Finally, you should know that prevention of strokes and TIAs is based on a healthy lifestyle and management of stroke risk factors. You can reverse your stroke risk, and some people with TIA and strokes may need surgery. I hope you enjoyed this video. Don't forget to share, and thanks for watching.